Star Valley Medical Center teaming up with Intermountain Healthcare, a very important program as far as coverage of your health. And we'll have Charlie Button, our CEO of Star Valley Medical Center, do an introduction and explain the program. First of all, Charlie, if you do our introduction.
Oh, sure. Star Valley Medical Center has been spending the last several months putting together an ICU program, intensive care. And this is new to Star Valley Medical Center. It's something that we've been wanting to do for several years. It really elevates our level of intensity of care. And so one of the components that we've needed is to partner up with a tele-ICU or telecritical care program. And we are doing that with Intermountain Healthcare. And here with me is Dr. Beninati from Intermountain. And so we are very pleased to have him and his organization be supplying that service to us.
Of course, Dr. Bill Beninati, appreciate you coming to Star Valley, sir. Could you explain the program and how it ties in with Star Valley Medical Center?
Yes, first let me say it's a privilege and a pleasure for us to be teaming up with Star Valley Medical Center. The way this works is that we have a team of nurses and physicians trained and specialized in critical care, working in a support center down in the Salt Lake area, and we currently connect to all of the intensive care unit beds within Intermountain Healthcare. And we're really there as a second set of eyes and a second set of hands in some ways to support the care of these very complex patients. And as Star Valley Medical Center starts managing critically ill patients here in the community, we will be forming a new teamwork here, and that teamwork is one that we know from our experience in Intermountain can really help improve the outcomes and save money at the same time.
With Charlie Button, CEO of Star Valley Medical Center, Dr. Bill Beninati, Intermountain Healthcare. As you do this, give us a visual walkthrough, gentlemen, of what we can expect to see and how it helps our patients specifically up here in Star Valley, and how it ties us into a much bigger network and more opportunities for improved health care.
Sure, I'd like to just start with that. Is just that the technology has gone so far in recent years and months even, as far as a physician being in another location can really have an interaction experience with the patient. And so that comes from they can hear, talk, and then also just with cameras in the technology is it's so much clearer than it was in the past that actually it is very beneficial for a communication between a physician that's in another location, actually helping tremendously with our staff here at Star Valley Medical Center.
And sir, Dr. Beninati?
Yes, so in the patient's room, they'll have a large screen, high definition television, and when the television can be used for entertainment, when that's what they're interested in, but when we're on the call, then a notification occurs in the room, and then they will see us from the torso up interacting with them. And there's a small picture in the corner so they can see what we're looking at within their room. Of course, we have the comparable thing on the other side. And as Charlie says, the quality of the audio-visual connection is good enough that we can have family conferences, we can talk about sensitive matters, and we can zoom in and examine body parts. We can look at someone's pupils. We can look to the back of their throat if they open their mouth towards the camera for us. We can look at lesions on their skin. And all of this information comes together so that we can help the team here at Star Valley formulate and execute the best possible plan for the patient.
Sounds like a good expanded service for everybody, for all involved, Charlie.
No, absolutely, and that's why we've been targeting this for several years of wanting this service, because ultimately we have a great staff. We have a great staff of physicians, but having this partnership with Intermountain is allowing us to do that. And we're targeting October 7th as a time that we're actually going to start our ICU program. And so again, it's a benefit to the community.
Very good. Anything that we haven't gone over, gentlemen, that you'd like to add or conclude with?
Yeah, I'd like to say that we have learned from our experience in Intermountain Healthcare that many people want to stay in their own community during a period of critical illness. And the analysis of our outcomes at Intermountain tell us that we can support that in many cases, and while allowing people to stay in their own community, close to their family, close to their friends, with their physician, still experience the benefits of advanced critical care medicine.